As one of the worst affected countries on the continent, South Africa has been battling the pandemic since it started. A new study shows how far-reaching the impact of the pandemic has been. It reveals that nearly every South African adult now has COVID-19 antibodies. The research done by the South African National Blood Service also found that just 2% of those sampled have neither been vaccinated nor infected.
We found that 98% of our blood donors in this last iteration had antibodies to anti-spike, which means that they'd either been infected or had been vaccinated. And 87% of our donors had antibodies to anti-nuclear capsids. So that meant that 87% of our donors were definitely exposed. And so normally one thinks of blood donors as a healthy cohort, and so we may underestimate the numbers. But when you get to 98%, you really can't, it can't be underestimated. So it really is showing that pretty much everybody in the country has either had COVID or has had COVID and has been vaccinated.
The study analyzed the blood of 3,000 people and found that most have been infected at least once. Other studies have also been conducted in different phases of the pandemic. The latest results, however, show a higher level of exposure.
So this is actually the third iteration of this study. It's a cross-sectional study that we've performed over the pandemic. It's the first cross-sectional study was done in March of 2021. We then did another one in November of 2021, and then this is the last one that we did in March of 2022. And in each of these studies were identical in the fact that we tested a number of donors who arrived at the donor clinic. We asked them if they were willing to be part of the study, and if they gave us informed consent, we then took samples and we tested their samples.
This is the first time that blood service researchers have been able to look at two different types of antibodies to evaluate the proportion of the population that have been vaccinated but not infected. The study also notes increasing evidence that many people have been reinfected during the Omicron wave.